Hello, everyone. My name is Muzammil Abdijabar. I'm lecturer at Zalingi University. Also, I am public health professional. I have multi experience in different institute. Work with Ministry of Health as health service manager in West Jabal Marra, and also lead the programs in international NGOs, in International Medical Corps. Also, I was a COVID project manager with International IMC or International Medical Corps. Additionally, I led the health and nutrition project with international also. All this led me to get see the public health in different perspective. That's why now we are trying to share our experience to develop our students' capacity and skills. And also, I see the develop the capacity at this time is very important and very yes, it's very important. I select need assessments to did it or to do the workshop about our students because I see the one of the very important skills for the health professional to know how can did the need assessment. This is the very top skills for the professional. Need assessment, that means how you can see the gaps if you need to do some project or some intervention at some areas is very important. Or firstly, you have to do the need assessment to know the exactly gap, and also to know the what is objective you need to achieve. Additionally, why I select you or let me to set public health students here, because really I realize there is a very I realize is a passion on you. Many of you they have very interested to develop themselves and to improve their skills. That's why I select you to do this workshop, and we can share the experience together, and let us to go in up. Before to continue, how about the voice and how about the video? Is it clear? Do you hear me?
Yeah.
Guys,
Yeah.
good. Okay, good. Now let us to share our screen. It's clear now. Is it visible? The screen is visible? Hello?
Yeah, it is okay.
Okay, good. Yeah, this this picture when we was in with IMC, we did some supervision areas there, and also include the assessment. Yeah, that's why I put it here. Firstly, let us to go in the definition. What is the need assessments? Need assessment is a process to identify and evaluate the need of the group or organization. That means how you can identify and also how you can evaluate the needs of the groups. Now, if you need to do the new project in Central Darfur area. Firstly, you have to go and make a need assessment that you can go to collect the data and then you can evaluate. The purpose of the need assessment to understand the gap between the current situation and the desired outcome. Yeah, to understand how the situation now, how the situation, like example, in Omkher area, as an example in Central Darfur locality. To understand the gap, the current situation, when you are doing the need assessment, you know the current situation of that area. What's the main healthy issue they are suffering from it? Perhaps the wash issue or nutrition, malnutrition, or can find the health facility issue. And then you can, when you are get the current situation, after that, what's the desired outcome which you are going to achieve it here? This is the purpose of the need assessments. Is it clear or need some clarification? Hello?
What makes it clear?
Yes.
Okay, good. You can go to third slide. Important of the need assessment. What is the main important of need assessment? First one, it is a guide the decision making, help us or help the organization or decision maker to make the prioritize the resource and action. When you have a resource and you need to distribute this resource, it's very important to make the assessment which area is more or high request with that resource. Yeah, that why the need assessment is important. That can let you to take the good decision. If you not did the need assessment, that you can suffer. Perhaps that decision which you are going to take it, perhaps it is not good. Yeah, but the need assessment you can give you the true decision because you can study the situation clearly. That can after that you can take a decision. Secondly, they enhance the program effectively. Also, if you have already have the project or program in the ground, to make sure how this program is implemented clearly or implemented very good, is very important to do the need assessment. Because with the need assessment, you are going to see the indicators of the project which you are putting through the need assessment. Need assessment can let you to collect the data of that project. Example, number of the malnutrition, number of the wash activities conducted during the months, and also number of the consultation at the clinic level, number of the discharge. All of this you can let you to be vigilant, to know to be vigilant, to know is it or we are in the tracking or not in tracking. Yeah, that's why it can let you to make the very effective program. The effective program effectiveness, that means are going to achieve the goals. You are going to achieve the goal or objective that you are putting during the planning. When you achieve the goal 100%, that means that project or program is effectiveness. Yeah. Thirdly, inform the stakeholders. Provide the data to support funding and support. The stakeholder, that means the donors or those people have affected by that project. Perhaps the population which consume that service, or donors, those whom are paying that money. When you are doing the need assessment, you can give them the data, or you can give them the reality which is there. Like the donors, they need the weekly or monthly or in the project, they need the data or report. When you are doing the assessment, that you can
slide. The same slide.
Yeah, inform the stakeholder. We are in this slide. Hello?
The last short slide.
Hello?
Hello? I'm saying.
You hearing me?
So move.
Okay, we can move.
Yeah.
Like we are finished from this slide. Important of the need assessment, we are mentioned the guys decision making, and secondly, enhance the program effectiveness, and thirdly, inform the stakeholders. When to conduct a need assessment, when we are going to conduct a need assessment, there are 3 times here. One, new program. Before to starting any service or new program, it's very important to make a need assessment, because we to let us know the exact situation, how those people they are suffering, how the target of those people which is suffering from the health or malnutrition or consultation, to know exactly situation. This is the first one. Second, existing program. When evaluate the effectiveness of the current program. Yeah, this is the second one. Third, the change the environment. When also the environment is the changing, also we need to make a need assessment. Example, like is there epidemics like cholera and also COVID-19. When there are some disease, maybe some outbreak, also that means need to make the need assessment, yeah, to know the situation and to know the needs of that population. Step of need assessment. Is there someone have some background about the need assessment? Hello? You hearing me? You can mute yourself. Hello?
Doctor, I'm with you.
Yeah. Do you have some background, the step of the need assessment, or some of you participate in need assessment?
No.
Okay. If no, let us to go or to see the step of need assessment. They have or there is a 5 step. Step 1, define the purpose of
Did the
the
service like two?
I don't know. What is wrong with me? I don't know. Anna, telephone list is like 2.
okay, perhaps internet. I don't know, perhaps internet. Yeah, let us to go. The step in need assessment. There is a 5 step. Step 1 is define the purpose, the outline, or let me say that clearly outline why you are conducting assessment. The first step of need assessment to clarify your objective, why you are going to do the need assessment. Yeah, the step 1. Step 1 to know the objective, why we are going to do the need assessment. Perhaps there is some epidemic, or perhaps we are going to make to see the worst situation in some area, or perhaps you can going to see the surface of the health. What else there? Yeah. Firstly, you have to clarify the purpose here. An objective. I'm going to do the need assessment in wash service at the Linji area, or in Niala area. Yeah, you have to put the objective clearly. This is the first step. Second step, identify the stakeholders to determine who will be affected by involvement. Identify the stakeholders. That means before you are going to conduct the assessment, you have to go to authorities at the state level or the locality level to make the coordination with them, to tell them there I have interest to do the new project in the Linji or in Jabal Marra area. Then I need to make the coordination with you to give me the authorities to go Jabal Marra area. Firstly, to identify the stakeholders at the state level and also at the locality level to make the coordination with them. Secondly, also you have to identify stakeholders like community leaders at that area. You are going to do the assessment. If you are going to some village or some cities, it's also important to make the coordination with the team leaders or community leaders to tell them we have some project like a wash project or nutrition project or health project, and we need to do the assessment to see the gaps, to see how to see the gap, and we need to collect some data to take the permission from them. Those stakeholders or community leaders, when you are make the contact with their community to inform them there is some people they are coming from Ministry of Health or from the XC organization, they are coming and doing the need assessment. That can let them to be ready. If they are if they find them, you can definitely cooperate with you and can give you the information that you are needed here. That's why the identify the stakeholder is very important to make the coordination at the all level and different stakeholders here to make a coordination. First, to collect data. Also, before to go in the field there to collect the data, it's very important to to prepare your survey, to prepare your interview questionnaire, and also to prepare your to see the reporting about that area, to know the all reporting, to see that reporting, and also is very important to do the questionnaire. Questionnaire means what? Questionnaire that means how you can collect the data, to organize your question, to organize the service you are needed, to organize all of that things in the questionnaire that can facilitate you to collect good data and complementary data. Yeah. Number 4, to analyze the data. Also, this is a step. After the collection, the data from that community or that place, it's very important also to make the analyze that data. This data which you are collecting, that data perhaps quantitative or qualitative, is very important to make analyze here, because the data without analyze that it is not it is not good. I saw some people, but you can continue. This lecture is already recorded here. Those suffering, those they are suffering from the internet, they can find them here. Analyze the data is important also to let the data which you are collection from your need assessment to be valid or to be more sense. It's very important to do the analyze. Analyze, you can give you information. When you analyze that data, you can give you information and can let you to know the real situation. Number 5, report finding. After make the analyze the data and you are find the information about that assessment, you can prepare the report. This report you can share with the Ministry of Health, and also you can share okay. Hello. Report finding. That result or that report which you are finding from the analysis data is very important to share with the stakeholder. Stakeholder is include the donors, and also include the Minister of Health, and also include the community leaders, to share with them that report, to tell them your situation in the water is very bad, or you have malnutrition risk, or very high number of malnutrition, or also some else here. You can share with them, because to tell them there to know what is happening there. Yeah, this is a step of the need assessment. Firstly, to identify the purpose here. What your objective you are going to conduct it. Second, identify the stakeholder. Stakeholder, you can share with them to make the coordination with them. After that, prepare the questionnaire that you are going to collect the data. Then you can analyze that data. After that, you can share that. You can do report and share that report. Yeah. Now we can go and see the collection data method. We have different type of the collection data method. We have a survey, like a questionnaire distribution, gathering the opinion of the people and information. Also interview, one-on-one discussion. After that, we have a group focus group discussion. Then we have observational. All these methods we are using to collect the data. Survey. Survey, we prepare the questionnaire. Then we share this questionnaire with that people to fill that questionnaire and collect their opinion and their information about that service we are going to do it. This photo at the Mugjar area, I don't know, some of you know Mugjar or not, but this is during the our service, which do it with our partner TDO. Yeah, we are going to supervise them. This is in the field there. Survey, as I mentioned, you have a questionnaire and distribute to gather in the opinion of the community. When you are going to make the needs assessment about the wash, you have a questionnaire about the wife, about the wash. Then you can distribute that to those community. Then they are filling that and collect information. Interview, that means one by one. You can select one person and ask them deeply question about their ideas or about their perception about something, and can give you full details in interview. This is the one by one interviewer and one interviewer. Yes, can collect them the deeply information which their experience or their insight. Yeah, focus group discussion, that means like from 6 to 10. They are collect them at the some place. You can collect the different people at that community, like 6 to 10 person, and ask them about their idea about that service which you are doing the assessment. How about the health? How was the main issue or main disease you are suffering from it, and is the critical health problem you are suffering? You can collect data from those group. Yeah, this is called the focus group discussion. Last one is the observation. Observation, you can see by your eyes, yeah, and make an observation and writing down here without any, yeah. Just this is the data collection method. As I mentioned, we have 4. One is a survey, second is interview, third is the focus group discussion and observation. Is it clear? Is it understandable?
Yeah.
Okay, good. Good.
Observe.
Let us to go. This is analyzing data. The data which we are collecting in the need assessment important, or it is very important to make the analyze, to take or to give the data sense. There is a different type of data. There are quantitative and qualitative data. Then, concern for the qualitative data, we are going to use the analysis, different analysis here. In qualitative analysis, use statistical to analyze the numerical data. That means the quantitative data is related with the numerical data. Can use this, which you collect in the survey result here. And this will use like SPSS, and also you can use like R regression. There are different type of logiciel or different type of method we are used here. Secondly, the qualitative analysis. Qualitative analysis examine the theme and partner from the interview. The qualitative data, it is not numerical. This is the just theme. It is the expression. Is many people, like someone is said, really we are suffering from the health issue, and other one is said we are suffering health issue. How you can analyze this data? Yeah, because it is not numerical. This is the theme. Is the expression of the people or of the participant. Yeah, this have the different way to analyze them. They are use different like Vivax or there is the different tools they are using here. Third, data analysis tools use the software like Excel and specialized program help analyze the data. Yeah, there is the different tools we are using in the data analysis. Reporting finding. After we are analyze our data, we have to make a report about our assessment. As I mentioned, firstly, we have make a objective or about need assessment. Secondly, we are make a coordination with stakeholders to let us to go at that area. After that, we are collect the data and use the different tools which I mentioned, like questionnaire, survey, focus group discussion. I use all that. Yeah. Then you can analyze that data. That which I mentioned there is the quantitative data and qualitative data. After make the analysis, then right now we have prepared the report, and this report to share with the stakeholders. Report finding. Firstly, create clear report. Summarize the key finding and conclusion and recommendation. The report finding we have make or we can summarize our key finding. What is the main finding which you are find in need assessment? Like perhaps or example, the wash activities. It is not wash activities. Number of the malnutrition cases is very high. Like people that suffer from the non-communicable disease. This is the summarize the key finding, very important finding from that assessment. Then can make the conclusion. After that, after conclusion, we can make the then we can make a recommendation. Recommendation for the donor, recommendation for the stakeholders here. Secondly, also is very important. We can use the visualize, include the flip chart and or chart and graphic or graph to illustrate the data. Use the visualize that let our report to be more attractive or to be more convinced or to be very nice here and be more attractive here. It's very important in our report to use the chart that be more attractive and be more clear. Also, you can engage stakeholder, present finding in meeting, and encourage feedback. After we are summarizing and make the conclusion our finding, we have to do. We have to make a share present finding meeting with those community or with those stakeholders, and to share with them the clear or key finding with them. Yeah. Implementation of recommendation. Develop action plan. Outline steps to address identify the needs. Also assign the responsibilities to ensure team members to know their rules and also monitor progress. This is our recommendation. Develop the action plan. Action plan, that means we can make the plan for the new intervention of the project, and also assign the responsibility, ensure team members know their roles. Every team members can know their rules, how you can do, and then we can monitor the progress regularly. Now we can go in the conclusion. You can wait like 1 minute or now we can make the conclusion. The need assessment is vital for effectiveness planning and resource allocation. That means the need assessment is a very effective planning that can let us to achieve our goals 100% effectiveness. And resource allocation, that means we can give us the vision, or we can give us the way how we can put it our resource in the good place. If we have a scarcity in the resource, the need assessment explain for us which project or which activities or which service is the top urgent for those community. Then through the need assessment can let us to allocate our budget or to allocate our resource in the good way. Final thought: regular assessment help organization stay responsive to change the need. Regular assessment helps the organization to stay responsive to change the needs here. That means it's very important to do the regular need assessment, because the need of the community or the people, their need with the time. Perhaps today you can find the cholera or monkeypox is the top urgent. Perhaps tomorrow you can find the other health issue to be top urgent. That's why it's very important for the organization or institute to do the regular assessment to help them to respond the community needs. Thank you for your attention. Now can open the question. Question from you. Is there any question? Or before to give you the chance, let us to make a summarize. As we mentioned, need assessment, you can let us to identify and evaluate the need of the group or the organization. And also, we are speak about the purpose or main objective of need assessment to understand the gap between the current situation and desired outcomes. Also, we are talk about the step of the need assessment, and we find the different step like firstly you can identify the purpose, then define the purpose or objective of the need assessment, why we are need to do the need assessment. Secondly, to find the stakeholders at the different level, state level, federal level, and also at the locality level or even community leaders. Also, third step, to collect the data. To collect the data, that means we can prepare the questionnaire, like a questionnaire to make the survey, interview, and also focus group discussion. After that, we can analyze the data. Then we can do the report, and that report can help us to make a good decision. Yeah, this is a summarize of our lecture. Then now we can see your question. Anyone have question? Please raise your hand and pose your question.
Okay, so I want to ask, especially on a type of so when it comes to analyzing data, so we have qualitative data and then quantitative data, right?
Yes.
So yeah, after I've collected my data, yeah, it's okay. I may be working on that, collected my data, but how I'll differentiate that this one is quantitative data and the other one is qualitative data, so that based on that I will finalize my decision.
Okay, good. Thank you, Mr. Honor, for your question. The quantitative data, that means when you are going and make like need assessment for wash service, like as those community, how many hall you have or how many wedding you have, like told you like they have 10. How many health facilities have in all this area, like 5. How many doctors they have, 1. How many nurses have, 2. Public health, 1. This is the quantitative data. That means numerical. But when ask someone, how about your experience with mental health? Well, I'm depression. Or when they're told you, how about the situation, work situation in your community? Many people they not have safe water, or they not have hand wash facilities, or like this here. This it is not numerical. This is like theme. It's the expression of the people. All this expression, we can make the grouping the theme. If during in our assessment, we are find like 10 people, they are said online, they are not have health facilities, or they have suffering from mental health service. This is, we can put it in the theme, like 10 people or 10 persons they are mentioned not have the health. This is the qualitative data, and there is the different way to analyze this data and explain that theme. Yeah, this is the difference between the quantitative and qualitative data. Yeah.
Thank you again.
Okay, thank you. You are welcome. Hello? Is there any question? This lecture already I recorded it. I will share with you. I will upload it in the in YouTube channel and can share with you in the group. Those they are not attend, they can find this lecture. Yeah. Secondly, this is the concern for this need assessment. It is not only we have a difference for coming lecture or workshop, because need assessment already I prepared like 3 to 5 lecture. Yeah. This it is not last one. Perhaps coming week also you can organize. You can see the good time and we can organize another meeting. Yeah. This just for the can give you the general view of the need assessment, because the need assessment they need deeply explain, or there is some checklist when you are going to collect the data. There are some checklists you are going to use it. Yeah. Also, we can see if they find there's some checklist, we can work also on that. Yeah. Additionally, as a public health professional, or let us to say the semi-graduate, also it's very important to have the another lecture which is like community mobilization strategy and also effective communication. And 1 minute, yes, yeah, bring also effective communication. All of this is the very important. Yeah. And also let us to can benefit from this gap or this time. Yeah. I'm waiting from you. Is there another question? Or secondly, ask how about is it clear this workshop? Is it clear? How about the diapo or presentation, and how about the voice, and how about the explanation? I need to see, is there something need to improve more, or is there something need to... Hello?
So for me, I would love to listen first from my colleagues, and then I will add mine later on. It's okay, because I think we're almost 10, and I think it's important everybody will share what he has or what she has.
Okay. Welcome, Mudessir. You can share your idea.
Great one. First time. It's a very good initiative that it to share the information, to collect or to gather ourselves from nowhere, and to talk about things that concerns us as public health specialists. Here, the point that I want to talk about here is that assessment here, mean the evaluation of the election workshop. I think cannot be direct. So I suggest for all who have attended the workshop here, we'll just try to share what was challenging us and what we will do next time to avoid all challenges that us in our group, and then we will just try to plan well to avoid all other barriers that we face in this structure. This is about the evaluation of the assessment or the workshop.
Okay. Thank you, Mr. Mudassir, about your suggestion. Yeah. Concern for the Challenges, yeah, there is many challenges. Perhaps the internet connection it is not good, and also there's some tools like Teams. Right now we are work our lecture in the Teams. Perhaps there are some people they are not familiar with this team, yeah, but within the time, yeah. Also, I suggest for you, it is not. I suggest for you when we have a lecture or we have a meeting, it's very important to join before 5 minutes, because if there's some obstacle or some challenges, you can overcome it, yeah, within 5 minutes. Yeah. Perhaps not have downloaded, or perhaps internet it is not good. That's why I told you or tell you to have to join before 5 minutes. Is there any suggestion, or you can say hi and see you later?
So what I wanna say is like I think they like now today is Thursday, right? Thursday is okay. That at least we'll be having like for continuously three weeks. It's okay. Next week I don't have problem. If we're going to continue with need assessment, and then if there's other thing we are going to like address in even next week, it's okay. So it's like Thursday, Friday. I think it's okay. So we'll continue doing it. If you have enough time or if you have free time. So
Okay,
because for
okay,
us it means a lot.
okay, good. I will plan, or I can organize to do it in the weekend, perhaps in Saturday or in Friday. I will plan or to organize to do the meeting at that yeah, in coming weekend, yeah.
Okay, it's good.
Yeah. Now, if there are not question, now we can leave, huh?
Okay.
Yeah. Lastly, thank you. Really, I highly appreciate for your passion and coming to attend these lectures. And it's very important to share ideas and to participate. As I mentioned, need assessment, one of the very important skills here. Right now, perhaps you can find some organization or can find some opportunities what you are else there. Can ask you as your public health officer, it's very important to do for us a need assessment. When you have a background about it, you can do it here. That's why I'm trying to give you some skills here. Secondly, if there are some changes for you, please let us to share with us here. We all of us the public health family. Yeah, we can share if there some challenges facing you there. Can share with us in the group or in the private email or WhatsApp. Yeah, we can make the cooperation with you. Yeah. Thank you a lot, and let me to say have a good night, yeah, and take care. Thank you. Have a good day. Yes, thank you. Yes, thank you.